Okie doke. Now let's move on to the next section, which is side effects. So there are quite a lot of side effects associated with the combined oral contraceptive pill. They can be summarized under three main headings. The first is minor complications, minor side effects, which are actually quite common. Then there's more troublesome side effects, which are not as common, and then severe adverse events, which are luckily quite rare. So let's discuss them all, and I guess let's start with the scariest of the lot, which is severe adverse events. So the most important of these to remember are those that are cardiovascular in nature. So using the pill increases your risk of developing a venous thromboembolism. So this could present as a pulmonary embolism, myocardial infarction, or a stroke, although strokes are seen to a much lesser extent. Now, it's important to realize that you don't need to be too worried in young women because the absolute risk of developing cardiovascular adverse events while on the pill is actually quite low. But that is in young women. But as you get older and as you have more risk factors, your relative risk increases quite significantly. So if you see the symbol, it just means associated with. So an increased relative risk is associated with increased age or increased risk factors. Okay, and then the next set of adverse events is that the pill interferes with your carbohydrate metabolism, and this can present as impaired glucose tolerance in some women. Likewise, it also interferes with your lipid metabolism, and this is because your estrogen causes your LDL to increase and your HDL to decrease. And remember, the LDL is the bad cholesterol and the HDL is the good cholesterol, so that's not very good. Okay, so then there's also an increased risk of cancer associated with using the pill, specifically breast and cervical cancer. So there's a small increased relative risk of developing breast cancer associated with the use of the pill. But some people think that this may be that the progesterone and the estrogen cause an accelerated growth of an existing tumor, not so much that it causes the development of a brand new tumor. So then with cervical cancer, there's an increased incidence also associated with the use of the pill. But there's a lot of debate about whether this is caused by the use of the pill or maybe whether it's a confounding factor, because a lot of women who use the combined oral contraceptive pill might have sex without using barrier contraception, and this might have an increased risk of contracting HPV and therefore developing cervical cancer. So basically, they don't know whether it causes it or whether it's just a confounding factor, who knows. But the important thing to remember is that for all women on the pill, you should increase surveillance so that you can pick up these things early if they do develop. Alright, then let's move on to the other side effects. So under the minor side effects, which are quite common, as I said before, you have nausea, dizziness, moodiness, mild headaches, and tender breasts. So you may or may not have noticed that ironically, these are quite similar to symptoms of early pregnancy. So this is important to remember when you come to management. So the first thing to do when managing symptoms, when a patient comes to you complaining of these side effects, is to exclude pregnancy, because these symptoms might just be from the pregnancy. Then the second thing, if you've excluded pregnancy, is to reassure that these side effects usually only occur during the first 3 months and then diminish thereafter. Another thing you can do is to advise them to take their pill with meals or preferably just before bed, because these can sometimes minimize the effect of the symptoms. Then if that doesn't work, you should consider switching to a combined oral contraceptive with even less estrogen, less than 35 micrograms. Or in some cases, there's been success in changing from a triphasic pill to a monophasic pill. Don't worry, you don't need to know the details of that. Or maybe just trying a whole new method, since there are a lot of other effective methods. And we shouldn't get stuck on the thing that the pill is the easiest one to use and the one that most people use. So yeah, it's important to also consider other methods. Okay, then we go on to the more troublesome side effects, which include breakthrough bleeding or spotting. So what this means is bleeding during your cycle when you're not supposed to be having your period, or in addition to when you're having your period. And then the way you manage this, if your patient presents with this side effect, the first important thing, as with the minor complications or side effects, is to exclude other causes. So other causes could be missed pills. If your patient's missing a lot of pills, this is going to cause them to bleed more frequently during their cycle. Then in a similar vein, it could also be severe diarrhea and vomiting, which are preventing you from absorbing the hormones in the pill, and so it's effectively the same as missing the pill. Then you must also exclude concomitant drug use, as well as pregnancy, because you might be experiencing an implantation bleed, or even symptoms of a miscarriage, and then other genital tract pathologies such as infection or even cancer. These can also present as breakthrough bleeding and spotting. Then once you've excluded all those causes, then you can consider switching to a different brand which has a lower dose of estrogen. If this still doesn't work, then another thing you can do is consider switching to a high dose. And then, so the use of a high dose pill for 3 cycles often provides good cycle control. Then you should switch your patient back to the low dose brand. And this usually prevents the troublesome breakthrough bleeding from coming back again. Another thing to remember is that the breakthrough bleeding or spotting is only a problem if, firstly, it's bothering the patient, or secondly, if it's lasting longer than 3 months, because it might just be as a result of the initial side effects if it is within the 3 months. And as with the minor side effects, you should also consider switching to another method if all of this has failed. Okay, so let's move on to our last section of the combined oral contraceptive, which is missed pills and what to do when you miss a pill. So I think one of the most common questions asked by people who are taking the pill is, what do I do if I miss a pill or if I forgot to take maybe 2 or 3 pills? So there are 2 different scenarios that you should advise. There's one scenario for 1 missed pill, and then there's another scenario for 2 or more missed pills. So let's go on to an example about if I miss 1 pill. So let's say I've been taking my pill Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Then on Monday, I'm supposed to take my pill at 6 p.m. like I usually do, but for some reason, sorry about that, but for some reason I forget to take it and I don't take it. So that's 24 hours after I took my last pill on Sunday. Then let's say I only remember on Tuesday at 5 p.m. when I'm getting ready to take my next pill, and I realize that I didn't take my pill yesterday. So then what you're supposed to do is you take the missed pill as soon as you remember. So I'm going to take my Monday pill at 5 p.m. when I remembered that I should have taken it yesterday. And then you continue the rest as normal. Then later that same day at 6 p.m. I'll take my Tuesday pill. And then I just continue as usual. And I should have normal coverage against pregnancy. So yeah, that's what you do. So even if it means you take 2 in one day, if you've missed 1 pill and you are between 24 hours and 48 hours late, then you can still take it when you remember and then continue as normal. Then the next scenario is if you've missed 2 pills. So let's say I take Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Then on Monday, I forget to take it. And then on Tuesday, I also forget to take it. Then on Wednesday, all of a sudden I remember that I haven't taken my pill for 2 days. So then what you do is a little bit different. Then let's say I remembered at 5 p.m. on Wednesday. Then I take the most recent missed pill as soon as I remember. So the most recent missed pill was on Tuesday. So I take that one at 5 p.m. on Wednesday. And then the thing that you must remember is that you do not take the other one. So I'm not ever going to take this Monday pill. I'm going to discard it once my packet is finished. And then you continue taking the rest as normal. So like with the previous scenario, I'll be taking 2 on Wednesday, but that's okay. And then I'll carry on as normal. The important thing to remember is if you've missed 2 or more, you need to use condoms or avoid sex for at least 7 consecutive active pills have been taken, because you won't have the same coverage. Okay, so now this part about taking 7 consecutive active pills is quite important, because let's say I take my pill, and then I forget on Wednesday to take my pill, and I forget on Thursday to take my pill. Then on Friday, I now remember that I've forgotten to take my pill for 2 days, and as per my doctor's advice, I take my most recent missed pill on the Friday that I remembered, as soon as I remembered, and then later on I take my Friday pill as per usual, and I discard this Wednesday pill. Then my doctor said that I'm going to need to use barrier contraception until I've taken 7 consecutive active pills. So these white pills are inactive. So what must I do? Do I just continue taking them in their order, or what do I do? So the answer is, if you're in this 3rd week, and you forget to take 2 pills, then you just skip these placebo pills, and from the Saturday pill, you go straight to the Friday pill over here. Sorry about that. And you just continue taking the Friday pill. So I'm going to take my Friday pill, and then, sorry, another Friday pill, but it's actually your Saturday pill, another one, another one, another one, until I've taken 7 consecutive ones. And so I just skip this placebo area and carry on with the active pills until I've taken 7. And then you're just going to have to discard those with your packet, and you're going to have to get another packet a little bit sooner than within 28 days. Yeah. Then another important thing to remember is that if you've missed 2 pills, you've become susceptible to the risk of pregnancy a little bit more than if you hadn't. So if you missed your pills, 2 or more pills within the first week, then you're going to need to, and if you have unprotected sex in the time that you didn't take your pills, then you need to use emergency contraception. But if you missed 2 pills in the second week and you've been good otherwise, then you need to take, so by good otherwise, I mean that you've taken your pills in the preceding 7 days consistently, and you continue to take them in the next 7 days consistently, then you don't need to use emergency contraception. You should be okay. And then, as I said, in the 3rd week, you're going to just leave out your placebo pills, and your coverage should be okay. Alright, so that is everything for combined oral contraceptive pills. Let's move on to the progesterone-only pill in the next video.